Have you or someone you know recently been diagnosed with colon cancer? If so, we're talking about the treatments and approaches for those diagnosed at Moffitt Cancer Center. And with more, Dr. Julian Sanchez, a colon cancer surgeon in the Department of Gastrointestinal Surgical Oncology and Gastroenterology at Moffitt Cancer Center. Welcome, doctor. How are you today?
Well, thank you for having me.
Thank you for making time to come in and talk about this. That's so important to have these conversations. And you were even saying too, you know, the background of the disease, those who are affected, screenings, I feel like sometimes there can be misinformation out there. So even before we begin talking about treatments, let's dive into the background.
Correct. Well, you know, colon cancer is one of the cancers that are increasing over time. We know it's actually affecting younger people now than it was years ago. So because of that, the colon cancer screening age has been lowered to 45. So the current guidelines are that everyone over age 45 should be getting colon cancer screening, either by colonoscopy, by blood test, in the stool test, guaiac, or FIT test. And all of those are good ways to prevent or actually screen for colon cancer.
And then, of course, say you do unfortunately get that diagnosis or know someone who recently had. Let's talk about treatments.
So, you know, unfortunately with colorectal cancer, the treatments can be kind of invasive in that we have to do surgery in order to remove that colon cancer.
Yeah.
But luckily, surgery cures most patients. So with surgical resection, we're able to save a lot of lives. The majority of patients will go on to get surgery once we confirm that there's no evidence of spread or metastasis.
And then, of course, what happens when it does come to the treatment? Is it things like follow the regular cancer that we hear about, you know, chemo, radiation, those kind of things?
Depends on the stage. So
Yeah.
really we care about, has that cancer spread to the lymph nodes? Has it spread to another nearby organ? That's not that common. So when we catch colorectal cancer at a very early stage, we're able to just resect that one portion of the colon, oftentimes without having to do a colostomy, without having really any impact in your quality of life. We remove that section of the intestine, put everything back together again, and now you're cancer-free. Those patients that do have spread to the lymph nodes or to the liver, then they'll need some chemo, but that's not the majority.
I would say that's interesting to hear that it doesn't metastasize that often. That's very encouraging to hear for those who have been diagnosed. When it does come to treatment plans, talk about the individualized approach that you are able to offer when it comes to Moffitt Cancer Centers.
Well, the nice thing about Moffitt is that what draws most of us to work there is that we're working alongside with our colleagues from across the disciplines.
Yeah.
So I, as a surgeon, am working daily with the radiation therapist, with the chemotherapy doctor, the medical oncologist, and we devise individual treatment plans based on each individual patient. So let's say a patient comes in with a specific mutation or a specific genetic analysis on their tumor, we're able to hone in their treatment surgically and with chemotherapy based on that specific patient and their specific tumor.
And so say there is someone watching out there right now, maybe they've already spoken with other doctors, but they're like, you know what, something's just not sitting with me. Do they go ahead? Is there a situation where, you know, their cancer or they've already had surgery? I mean, when should they contact you? Who is that right person to reach out?
I think first and foremost, anyone who has any really uncertainty about a previous diagnosis or things just aren't feeling right, you should seek another opinion, right?
Yeah.
We are our own best advocate for our own health care.
Yeah.
So among those patients who've already been diagnosed with cancer, we know that the earlier you get treatment, the better it is. So we recommend everybody who's been treated or diagnosed with cancer, who is waiting for surgery, waiting for an opinion, to go ahead and make that appointment, to give us a call and get us in to see them so that we can start the treatment right away.
And it sounds like, too, you understand time is of the essence, and that means getting patients in as quickly as possible.
Absolutely. So we've started a new endeavor here at Moffitt where we're trying to get patients in within a week of the phone call.
Oh, wow.
So when the patient gets diagnosed, you know, today, let's say for their colonoscopy in the morning, and they get the bad news, within a week we're hopefully seeing you at Moffitt, planning for your surgical resection and your cure.
Oh, and so many positives, both physically and mentally, when it comes to that quick turnaround and being able to see you. Well, if this is really hitting home and you want to know more information about Moffitt, we're sharing that on your screen right there. Thank you again, Dr. Sanchez. I really appreciate talking with you today.
Thanks for having me.